Hello, site coordinators of clinical education, clinical instructors, and students. This is Dr. Allie Young, Director of Clinical Education at the Arkansas Colleges of Health Education School of Physical Therapy. I just wanted to take a minute to welcome you to the Clinical Internship Evaluation Tool, or the CIET Training. This training will give you specific instructions for evaluating our students while they are on their clinical experiences. AIC will no longer be using the Clinical Performance Instrument, or CPI, to evaluate student performance on clinical experiences. This decision came after clinician feedback that the tool was too long, too redundant, and difficult to access. Exploring alternatives was needed to address these concerns, but always with the understanding that feedback on student performance is essential. After investigating our options, we have decided to begin using the Clinical Internship Evaluation Tool, or the CIET, which was developed by the University of Pittsburgh in 2007. The training and tool completion should take less than 30 minutes, and there are no separate account or passwords required. All you need is an emailed personal link. We believe that this is the future, and we are excited to introduce you to this tool. Our objectives for this training are to familiarize all users with the CIET, to make sure all users understand the CIET's definition of a competent clinician, and to clarify how to use the CIET rating scale to effectively evaluate student performance. The ultimate goal is for every student to earn a high 5 or rating of 5 on the CIET. The measurement of student performance in the clinical learning environment is an essential part of physical therapy education. First, it helps programs adhere to the requirement of CAPTE, our accrediting body, that every student achieves safe and competent entry-level clinical performance by graduation. It also provides a platform for feedback to promote student growth. It allows objectives from both the clinical sites and academic programs to be met. And lastly, it protects the public in the PT profession. The CIET will assess student progress towards competence across 3 terminals, 2 9-week terminal clinical experiences, and our final 14-week terminal clinical experience. Completing the CIET is intended to be an efficient and straightforward process for both the clinical instructor and the student. This tool provides a comprehensive approach to student assessment with a dual focus on competence in professional behaviors and patient management skills when compared to a competent clinician. A competent clinician is defined as one who is able to skillfully manage 100% caseload in an efficient manner to achieve effective patient or client outcomes. The expectations for skill and efficiency can be unique to your specific client's clinic's population and expectations. Each academic program sets its own standards and expectations for student performance. This training will explain how to properly utilize the tool as well as the expectations for all AIC DPT students. The CIET is made up of 3 sections: professional behaviors, patient management skills, and an overall global rating scale of clinical performance. We will now explain each of these in more detail. The first section is professional behaviors. It is broken down into 4 unique categories: safety, professional ethics, initiative, and communication. Safety includes the ability to maintain safety for self, others, and the patient. Professional ethics includes adherence with ethical and legal standards, as well as rules and regulations, including those for behaviors and appearance. Initiative includes the frequency with which the student takes advantage of learning opportunities, including accepting feedback, utilizing resources, and demonstrating flexibility. Communication includes both verbal and written skills with patients, families, and other healthcare professionals. When assessing professional behaviors, the frequency of the appropriate behavior is the objective measure, ranging from always to never. Never is self-explanatory. Rarely implies the student demonstrates the appropriate behavior less than 25% of the time. Sometimes indicates about half the time. If you rate a student never, rarely, or sometimes, please contact the program to discuss your concerns with the DCE. Most of the time refers to more than 75% of the time, and this is our expectation at the end of terminal clinical experience 1 and 2. Always is more than 95% of the time, and that is our expectation for the end of clinical experience 3. The descriptor not observed can only be used for communication skills the student has not yet had the opportunity to demonstrate. Each section has a comments box, so please always add comments to explain your scores and identify strengths as well as areas for development. The second section, Patient Management Skills, looks at the student's ability to effectively manage a patient through each component of the patient-client management model, as defined by the APTA's Guide to Physical Therapy Practice. Examination includes history, systems review, and tests and measures. Evaluation include the analysis and synthesis of data, critical thinking, clinical decision-making, and determining the patient's impairments or functional limitations. Diagnosis and prognosis include determining the physical therapy diagnosis, the optimal level for improvement, specific goals, the plan of care, and criteria for discharge. Intervention includes choosing and applying appropriate treatment, providing patient and family education, monitoring responsiveness, and recognizing when discharge is appropriate. For patient management skills, you will rate the student after considering two criteria: how much support the clinical instructor provides and what types of patients the student is comfortable treating. Ratings range from well below to above. Well below means the student requires guidance from the CI for all patients. Below means the student requires supervision for all patients, or it is not effective in time management. At the level for familiar patients means the student independently manages familiar patients, but supervision is still required, or significant inefficiencies are present. For complex patients, independent means the CI provides only occasional consultation for best outcomes. At the level for all patients means the student is functioning at the level of a competent clinician for all patients, both simple and complex. Above means the student is functioning beyond the expectations of a competent clinician for all patient types. A few definitions can guide your ratings. Guidance means the CI must be present for all evaluations, treatments, and clinical decisions. Supervision means the CI provides verbal cues to facilitate decision-making, corrects minor errors, and monitors for efficiency or effectiveness. A familiar patient is one without a complex medical history, frequently seen in the clinic, and learned about previously in the classroom. A complex patient is one rarely seen in the setting with multiple comorbidities and never learned about in the classroom. It is important to understand that if a student performs at varying levels, you should always default to the lower rating. For example, if a student is at a level of familiar patients when working with orthopedic diagnoses, but below when working on neurological diagnoses, you would rate the student at the lower of the two levels and be sure to write comments in the box provided. Let's look at an example. During week 5 of her clinical experience, a student completed 3 new patient evaluations. 2 were familiar orthopedic diagnoses. She made accurate clinical decisions and identified patient limitations with only verbal cues to measure range of motion above and below the affected joint. The 3rd was a more complex neurological case during which she required supervision for all aspects of the evaluation, including identifying limitations and choosing appropriate tests and measures. She was clearly more comfortable during her orthopedic evaluations. How would you rate this student on the patient management section? This student is performing at level for familiar patients when it comes to making clinical decisions based on gathering data, but requires more support with complex patients. She is making the link between impairments and activity, but because she needs clarification from the CI, she would be rated at level for familiar patients for identifying impairments. Because she required supervision and verbal cues for identifying appropriate tests and measures for both familiar and complex patients, she might be rated below for that component. Following each component of the patient management section, please always add summative comments to explain your scores and identify strengths as well as areas for development. The final section of the CIET is the Global Rating Scale. This provides an overall assessment of the student's performance on a level from well below to a competent clinician and above. Ratings of 0 to 1 are well below expectations. These students are unable to carry more than 25% of a caseload and are struggling with safety concerns or red flag behaviors. A rating of 3 is progressing well, carrying 50 to 75% of the caseload. This is the expectation at the end of CE1. A rating of 4 is on track, carrying greater than 75%, and this is the expectation at the end of CE2. At the end of the final CE3, it is expected that students receive a high 5, a rating of 5, defined as functioning at the level of a competent clinician who can skillfully manage a 100% caseload in an efficient manner. Please be mindful that this is similar to expectation of a new hire or new grad, not the experienced employee. Ratings of 6 through 9 are reserved only for students who demonstrate exceptional performance beyond entry level, and a rating of 10 is well above a competent clinician, such as a master clinician or clinical specialist. At the bottom of the global rating scale, you will see a question asking if the student is practicing at a level satisfactory for the current level of education. This provides a final indication of satisfactory performance given the level of academic preparation using a simple yes or no. Selecting no alerts the university that the student is not performing at a satisfactory level and should result in your immediate communication with the DCE for further instruction. We want to thank you for taking the time to learn more about the CIET. This decision was ultimately made with the busy clinician in mind, and we have created quick guides and reference tools to assist you with your completion. As with any change, we will be requesting your feedback on the tool and the training in the near future. Thank you for your clinical partnership with the Arkansas Colleges of Health Education. Your time, energy, and clinical teaching are paramount to the success of the AIC School of Physical Therapy. Please do not hesitate to contact us with any additional questions or concerns.